Managing weight loss is a big challenge for millions of Americans, and with the new year, many people are hyper-focused on losing weight, and here to help is Dr. William Johnson, a bariatric surgeon from Atlanta Bariatrics. Dr. Johnson, welcome to ATL Live.
Thank you very much for having me.
Yes, thank you for being here. So, the big question a lot of people have is they're considering weight loss surgery, right? But they want to know, what kind of results should they expect?
Yeah, I mean, it's tough to lose weight on your own. A lot of people really struggle, and those who struggle continue to struggle. It's a lifelong struggle. So with surgeries, we're going to give you a change that's going to allow you to lose weight more permanently and give you a realistic chance to get significant weight off. With a lot of these surgeries, we end up losing, when we talk about excess weight, so you talk about the amount of weight you have your ideal body weight and how much you weigh above that ideal body weight. Most people lose about 60 to 70% of your excess weight.
Oh, wow.
You're going to lose 40, 50, 60 pounds in 3 months. So you're going to see real results. And as you see those results, hopefully that's going to encourage you to want to eat healthier, exercise more, your knees are feeling better, your back's feeling better, you're sleeping better, and it's just going to create more weight loss.
Oh, yes. Okay. And when we talk about the post-op, right? Because that's the part that can be a little nerve-wracking for people.
Sure.
What's the recovery time?
Yeah, I mean, these surgeries have come a long way. I mean, now most of our surgeries are done as an outpatient. You're able to go home. Most people go home the same day, and if not, they stay overnight in the hospital and go home within 24 hours. We have a lot of patients that are done at outpatient surgery centers, and so you're up walking right away. People often ask, when can I start walking? It's 30 minutes. You're going to walk to your car after the surgery.
Wow.
That's how fast you're recovered. Most people are back to work in about a week, and most exercises in about 3 to 4 weeks. And so it's a quick recovery.
Awesome. Now, how long does the weight stay off?
Well, this is where it gets to the patient's commitment. Our job with this surgery is to do a good surgery for you. It's a tool at the end of the day. You have to use the tool correctly. And so it's my job to teach you how to use that tool and have a system set up to make you successful. And it's a patient's job. You can't eat much with these surgeries. You're going to feel very, very full eating that small amount of food. What food you eat is up to the patient. And so we're going to teach you about eating. You can't eat much, so let's get your meat in or protein in first, get your vegetables in second. And you do those kind of things, you'll keep this weight off long term, but you have to make the commitment. If you just do average with diet and exercise, you're going to do average with weight loss. If you're going to do above average, you're obviously going to have to work a little harder than the average patient does who gets the surgery. But I'm taking a group of people that's failing everything. They're failing all these diets, all these exercises. I'm taking that group of people and we're making them lose significant weight. How well it stays off, that's where their commitment comes in.
Okay, fair enough. Now, you've worked with hundreds and hundreds of patients.
Thousands.
Thousands, okay. Yeah. Well, you have worked with thousands of patients. We've seen all sorts of results, and I'm sure there are some really great stories. I'm curious if you want to share any successes as we watch these incredible results cycle behind us here, too.
It's amazing. I mean, people often ask, why do you do these surgeries? I mean, we love, myself, our practice, we love watching people just change their lives. There's very few things in medicine that have this impact where we can see this dramatic of a result, this dramatic change. People are coming off medicines. People are, they come in wheelchairs often, and they're now walking and getting around. They're exercising again. Things that don't seem like a big deal at the time, if you don't have a weight issue, crossing your legs, sitting comfortably in an airplane seat or a booth in a restaurant. Those things are now possible. They can walk into department stores. Clinics are happy places. The people are really happy, they love it, they wish they'd done it years ago. I hear that every single clinic. We have patients that have gotten their transplant because they've now can get to a weight where they can do it, or get their knee replacements. They just get their lives back, and they're generally just a fun group of people to take care of, because we watch them go through that whole journey.
Beautiful. Dr. Johnson, thank you so much for being here. And everyone, if you would like information on all of this that we just discussed, please visit atlantabariatrics.com.